Hi Jane.
Hi Mel.
Could you tell me a bit more about your role at Shropcom?
Yeah, so I'm a paediatric speech and language therapist. I work with young children across the trust who have eating, drinking and swallowing problems. I'm the clinical lead for that service for dysphagia.
Yeah, so I work, I'm a children's physiotherapist and I work in the community mainly with children with respiratory conditions. So that includes children with things like cystic fibrosis or like yourself, complex conditions. So previously I've done a rapid response role at children with at Birmingham Children's Hospital.
I've done lots of different things. So I started off by being a very generalist. I was lucky when I started, you could do both adults and children.
Yeah.
So I did that across the county of Devon. I split my time between clinical and college, and I had to choose between adults and peds, so I went for the paediatric caseload.
I did, as we do when we qualify, you do like a rotational system,
Right.
and I did adult rotations, and then my last rotation on that band 5 pathway was paediatrics, and it just lit me up. And I thought, right, this is what I want to do.
I did A-levels, and I went straight from A-levels to do a Bachelor of Science honours degree at University College London.
I was very lucky. I don't think they do it anymore. Again, we're going back a little while. They used to do it. It was called a pre-paramedic A-level course.
Okay.
So I did 3 A-levels, not 4, and then a day a week work experience. I actually did some time with the paramedics as well and the nurses, radiotherapy as well. So I did that, and it built up a picture, just so I knew which profession that I'd prefer to do. I think it's quite important to get experience first of the actual role,
yeah, I do.
to know exactly what the job is, because I think that's where there's massive gaps. I mean, if you think about a physiotherapist, if you ask somebody what a physiotherapist does, for example, they won't really know what we really do.
No.
They'll think of football and massage and things like that, which absolutely isn't the case, is it?
I actually thought I might be a physio when I
Did
started.
you?
Yeah, that was the first thing I was looking into, was physiotherapy. It's not that I wouldn't like to be a physio, I think it's a brilliant job, but speech and language therapy suited me better.
Yeah.
I love the helping the families to see the positives and to know how to manage. They've got a problem, how do they manage that? How do they make a difference? I'm not only sharing my knowledge, but I'm gaining knowledge from other people all the time.
Yeah.
So
I really like working in the community. It's very flexible, isn't it? And I really like being able to take my advice and expertise to home.
Really?
And a lot of those children have respiratory problems.
Yes, they do.
They also can have neurological problems as well, so I can help with all that. I think that's a big part of our role, isn't it? Is actually developing services.
Absolutely.
So actually seeing the gaps and filling them with our expertise. And I've done a lot of work with big hospitals, which involves a lot of on-call and crisis work. Okay. So with my rapid response role in Birmingham, I felt like a paramedic. I was walking around with a big rucksack. I'm involved in a national group of prescribers for cystic fibrosis, and when we first started there was 5 of us that started this course. There's now 43.
Fantastic.
Yeah. So the physiotherapy service does have students. We have students at every cohort really. And I think the students enjoy coming into paediatrics.
Yeah. We all have students as part of our Royal College, sort of our HCPC, our professional body, the same as yourselves. So it's something that we are signed up to doing, to bringing on the next generation of speech and language therapists. Because even when you're training, I think it's quite difficult to know what it actually is to be a speech and language therapist. We do try and get the students involved in face-to-face assessment and therapy with the children, but we also get them to do all the other stuff.
I take them into the hospitals as well, and we do cystic fibrosis clinics, meet the consultants in a hospital, so they've still got that link. But yeah, I think they quite enjoy. I think we've got good student placements, haven't we?
Very.
I personally would say that getting some experience of the career that you want to pursue.
On our website there's quite a lot on there on the career and what it might be and what it might entail. So I think doing a little bit of research as well. So I've actually thought that I would like to get into some more research recently as part of my role with feeding, because I think there are quite a few gaps in our knowledge base for our evidence-based practice, there's lots of support out there. And I think there's toolkits that are available to people. So it's about looking and finding those out, contacting the universities, isn't it? And I did a little bit of dysphagia work all the way through. And the team have been incredibly supportive to offering me supervision, advice on my career and how to where to go for extra information, where to go to develop my knowledge. I feel very grateful for the support and the supervision that's been provided.
I don't think that's just at our level either.
I think it's across
everybody, no matter what your band, you're supported to do what you want to do course-wise.